Hello, everyone. Thank you for attending and tuning in to Building Community Health Workforce of the Future. My name is Maria Plata, and I will be your host for the next hour. Today, we will discuss the importance of community health workers, individuals who help eliminate barriers to care by offering culturally relevant health information and connecting people to health and social support systems. You'll hear from current and former community health workers, as well as United States Senator Kirsten Gillibrand, about the essential role of this critical workforce. We'll also leave you with a few steps you can take right now to support community health workers across the U.S. I am honored to be joined by Denise Octavia Smith, the founding executive director of the National Association of Community Health Workers, Tawanda Austin, a senior community health worker at the Penn Center for Community Health Workers in Philadelphia, and Odile Guerrier, a community health worker at Healthcare Network in Immokalee, Florida, where I'm also from. These individuals are just a few of the thousands of community health workers across the globe. In fact, for nearly 3 decades, Partners in Health has hired and trained community health workers around the world to help make high-quality healthcare accessible. Living in the communities where they work, community health workers address a range of physical and mental health conditions, including HIV and TB care, chronic disease management, nutrition, and maternal and child health. They also make sure that everyone has access to social support such as food, medicine, safe housing, and financial assistance. Over the last year, community health workers have been instrumental in COVID-19 prevention and care. They have shared crucial information about the pandemic with their neighbors, while also connecting people to basic resources so they can safely quarantine and isolate. When vaccines became available, this workforce supplied transparent information and helped neighbors sign up for and get to vaccination appointments. In fact, after learning about the impact of community health workers in my own community of Immokalee, Florida, I began working as a community health worker myself at the beginning of the pandemic. Immokalee is largely an immigrant and farm worker community, both experiences I can uniquely connect with given I am the daughter of migrant farm workers. More recently, I have transitioned into the project manager position at Partners in Health, which has allowed me to support many more community health workers. Now, to start us off, I am honored to introduce a short video from United States Senator Kirsten Gillibrand.
Over the past year and a half, COVID-19 has laid bare the failures of our health system, which invests far more money in treating illness than preventing it. The pandemic has also magnified the systemic health inequities Black, Latino, and Indigenous people have faced for far too long. Those communities are facing infection, hospitalization, and death rates 2 to 3 times higher than those of white communities, in large part because they have fewer health resources. Every community needs to have a public health system that can meet its unique needs. That's why I fought to build a public health workforce and worked to secure nearly $8 billion in the American Rescue Plan to start recruiting, training, and employing hundreds of thousands of Americans to work in public health. That includes more than $200 million of investments in community-based organizations working on vaccine distribution and equity. As we build our public health workforce, it's imperative that we hire workers directly from the communities they serve. The last year has shown us how important it is that we build trust in the medical system. One of the best ways we could do that is by building a network of trusted messengers in every community. People who know you, who understand your hesitations and circumstances, and who can address your concerns. Community health workers have spent the last year doing that work, sharing crucial public health information and connecting people to food, safe housing, and financial assistance. And when the pandemic finally ends, they can help us address other ongoing public health needs, like maternal and child health, mental health, nutrition, and more. They will provide much-needed reinforcement to our overtaxed health system. These critical investments give us the opportunity to reevaluate our approach to the pandemic and choose the path that also helps us build a stronger, more equitable public health system that will help us meet the needs of the future and address the failings of the past. Community health workers, like those you'll hear from today, are key to making that vision a reality, and I'm proud to join Partners in Health, the National Association of Community Health Workers, and community health workers from Healthcare Network and Penn Center for Community Health Workers today to talk to all of you about the importance of this essential workforce.
Thank you, Senator Gillibrand. It's always a pleasure to hear from you. We are grateful for the work you're doing to support investments in community health workers and build a healthier and more equitable future for all Americans. Now it's time I introduce our panelists, Denise, Tawanda, and Odie, to talk about the importance of community health workers and our shared passion of community health work. First, Denise Octavia Smith is the founding executive director of the National Association of Community Health Workers. As a community health worker and healthcare administration professional, she designs and implements community-centered strategies to achieve equitable, diverse, and inclusive partnerships, programs, and environments. Through a development program, research, advocacy, and collaborative partnerships, Denise pursues a culture of health where individuals have self-determination and dignity, where communities meaningfully contribute to system design and governance, and where societies address structural barriers to well-being. Tawanda Austin is a senior community health worker at the Penn Center for Community Health Workers in Philadelphia. Tawanda has worked with more than 300 patients, advocated for the creation of a clinic-based position to support new mothers, co-led resident trainings, and welcomed nursing students to shadow her work, knowing they can work hand in hand to provide comprehensive healthcare and support to their patients. Tawanda is also the founder and CEO of a nonprofit called Moms Like Me, which is aimed at supporting and empowering working class mothers and their families. Odiles Guerrier is a community health worker at Healthcare Network. He has earned both a degree as a doctor of medicine in the Dominican Republic and a nursing degree in Puerto Rico. Prior to joining Healthcare Network, he worked as a certified medical assistant for a local pediatric medical clinic and also worked with Partners in Health in Haiti to help build healthcare organizations and services with patients with HIV and tuberculosis. Odie has a passion for providing excellent healthcare and feels an obligation to help prevent the spread of COVID-19 and other viruses and diseases. Welcome, Denise, Tawanda, and Odie Lest. Let's start with some background information on this workforce and why their work is so vital to ensuring the best care for our communities. The term community health worker is probably new to many of us, and they are often referred to as different names, but have one mission: offer compassionate care to those who need it most. What is a community health worker to you, and why are they so critical to the U.S. public health system and providing equitable care before, during, and after this pandemic? Denise, I'd love to hear your thoughts.
Thank you so much for having me, Maria. I want to thank Partners in Health for creating this environment and this continued advocacy in the U.S. and globally on our profession. I also want to thank Senator Gillibrand for her advocacy and action for the community-based workforce. So I want to briefly bring you greetings from the National Association of Community Health Workers and our membership and board in 48 states. There are 5 things that I think are critical for people to understand when we talk about this workforce. Number 1, we are a unique workforce. We are compassionate and committed frontline public health professionals with deep trust and shared life experience with those that we live, where we live and serve. We have a U.S. Department of Labor workforce classification. We're recognized by the Affordable Care Act as health professionals. We've developed our own professional core competencies, and we were classified as essential critical infrastructure workers by the U.S. Department of Homeland Security when the COVID pandemic began. Number 2, we're a historical and a current workforce. We've existed in communities across the U.S. for hundreds of years as healers and advocates on chattel slavery plantations, as community health representatives, preserving well-being and language and culture on U.S. tribal nations, as promotores, as aunties, outreach workers, peers, and dozens of other work titles among immigrant and refugee communities across Latino, Asian American, Pacific Islander, Native Hawaiian, and Alaska Native communities. Trust respect, and dignity for all human beings is at the center of who we are and what we do. The reason we have this compassion and commitment to families and communities is largely due to our shared life experience. We live like, we look like, and we're often survivors of or dealing with the same chronic diseases and structural barriers to health and well-being as the people where we live and serve. Number three, we're a cross-sector workforce. We're serving in faith-based institutions, ministries, homeless shelters, food pantries, cancer and HIV outreach, advocacy and support groups in nearly every sector, from education, mental health, workforce development, immigrant rights. Number four, we're a proven workforce with over 60 years of effective evidence. And Maria mentioned many different aspects: maternal and child health, chronic disease, immunization, oral health, and many, many others. We're also increasingly recognized for our contributions to address racial equity and the social determinants of health. And number five, we are a precarious workforce. That means we're comprised of a majority female workforce with the racial, ethnic, and gender identities across the United States. We're some of the most lowest paid among healthcare professionals. And our organizations in communities across the country remain dependent on short-term grants instead of sustainable reimbursement models. So we often lack the professional identity, the respect, the protection, or the authentic partnership that we need in our communities.
Thank you for sharing that, Denise. I know even myself, before this pandemic, I actually didn't know what a community health worker was either. And to know that they've been working, in communities for decades, it's not, until they got official names and titles, but this has been going on for such a long time, and it's so vital and so important, but oftentimes is put to the side. Like you mentioned, they're normally underpaid, and that's what we want to do, is people from our communities actually being the ones assisting and providing and creating that bridge, right, between healthcare systems and social support systems.
Yeah, and I often tell people I did not use the term CHW to describe myself for at least a decade while I was working, and I perhaps Tawanda and Odelest have a similar sentiment. We do this work because of our compassion and commitment, but we use CHW as an umbrella term to acknowledge our profession across sector and ethnicity and geography.
I know oftentimes too, how people get involved into this work is usually somebody else identifies you in the community and says, this would be a really great role for you. Tawanda or Odelest, did you experience any of that? Yeah, how did you find out about this work?
You want to go first?
Sure. So yes, I experienced that. I never knew what a community health worker was, but someone, her name is Ms. Norman, she saw that in me. She said, you know what, this would be great for you, fill out this application and we want you to do it.
So here in Immaculate, so we define ourselves as trust builder in the community. So which we're trying to do as a bridge between the community and the healthcare system, because San in Immaculate, it's very large underserved community without access to healthcare system for many reasons. So as community health worker in Immaculate, we do as an advocate for those in the community, since they have a lot of concern barrier because of documentation, status, transportation issue, language barrier, or cultural belief. So since going to the doctor, even like see as a sign of weakness, as a financial problem. So there is a lot of challenge. So our main goal at the COVID-19 team, our community outreach team, is improve outcome for the community. That's may or otherwise not get quality COVID-19 tests or vaccination. So which are our main focus. We love what we're doing and we are passionate about it.
Thank you so much for sharing. And that brings me to our next question. Because community health workers are hired from the community they serve and are fluent in the language and culture of the region, as many of you have already mentioned, they're uniquely positioned to connect neighbors to health and social systems, while also alleviating those fears that we just talked about. What is unique to the work you do and the community you serve, especially since we know Immokalee is different from the Penn State Center? What is unique to the location you're serving, and then how do you think your lived experiences and familiarity with the community benefit your work? Would anyone like to start us off?
I would definitely say that what's most unique about my position as a community health worker is that I get to actually experience or know who that person is on a firsthand basis. I get to know challenges that they're facing in their lives and how I can be a better support to that patient. We use a tool at Penn Center called the Meet the Patient interview, and that allows me to get deeper into who that person is, what's important to them, and what are their own health goals that they have for themselves. But I am the bridge to that person to help them to be able to navigate through those social resources that they may need to help their lives become more manageable. And that's a very fulfilling reward at the end for both.
So because like we have like spent last year like canvassing door to door, like going to the door to the neighborhood, doing testing and vaccine event, and many neighborhoods we know from FAC and Immokalee, between like one family only speak one language, Spanish or Haitian Creole. Like between 20% of the population only speak English. So working as a workforce, and we have a community health worker between multicultural language like Spanish, English, and Creole. So it's a really helpful for the community trying to build trust, like because those communities, underserved community, they work in the field or parking houses or local business supporting the community. And there's a lot of lack of education, mistrust, language difference, so low level of literacy, so lack of technology. We witness a lot of challenge, and we create those challenges like protecting the community. So as a community health worker, so we are a trust member. So local community who share life experience with the same as the neighborhood, serving a link between the community. So talk with the same language they can speak, they make them feel comfortable in the community.
And I think something you mentioned, Odie, that's very important for us to remember is these, the lack of is usually these barriers, right? And sometimes these barriers they're structural, they might be structural barriers, they might be maybe because of like socioeconomic status or even documentation status. And so I think as like a former community health worker myself, just thinking about like all these different barriers or even challenges that folks have in these communities, it's really important that community health workers identify that. They create a trusted source. They're like a trusted source in the community because, like you mentioned, you speak the same language, you might share the same culture. And even if you don't speak the same language as someone else, even if you attempt to do so or have your team members who speak the same language come in and provide that care or, letting them know like where they can go. And that gives them now information that they didn't have before, because we're really navigating these resources because we now have this information. I mean, we as, community health workers are not anymore, I would say like more educated in this, but we definitely have the information, whether it's by lived experience or we're trained in it. And I think that's really important that we do recognize that and also are able to provide that care. Denise, is there anything you wanted to add about the work that you do? I know you said you have 20 years of experience. It would be really interesting to hear a little bit more about what you did at the beginning and what is a little bit different from, I know now you're an executive director, but what was your, I guess, like your history, your past with community health work, especially when it wasn't as recognized as it is today?
Yeah, I started my career. Of course, I didn't know that I was starting a career at the time, but really I started my career because of my mom. I'll tell you a funny story. I was actually thinking about this earlier today. It was 1982. I was 12 years old, and I was living in my town, going to middle school. I think it was 6th or 7th grade at the time. And my mom was an HIV advocate. She was working in public health. And I remember she gave me this T-shirt. We didn't have uniforms at school, so you could wear whatever you wanted. And this T-shirt was a white T-shirt with a little cartoon penis on it, with a little cartoon condom. And it said, "Cover me, I'm going in." And I remember how proud I felt to be sort of bringing this conversation. My older brother was mortified standing at the bus stop with me. And I felt so proud because it was sort of inspiring and igniting all of these conversations. And I thought, yes, I am at the front of this really important conversation at that time about HIV. We know that the level of stigma, the lack of resources, the lack of clinical treatment for HIV at the time meant that for most people, HIV was a death sentence. And it was really important not only to destigmatize, but to really broaden people's awareness of what the risk factors were, right? Beyond the myths, beyond the misinformation. And as a young preteen, I felt a part of that. I never left that work. As I began to get older, I traveled around the country a little bit, but mostly I came back to work in HIV. There was something about the innovation that was happening deep in community to address some of the needs at that time of people living with HIV meant that you not only had to address their medical or clinical issues, you had to address issues of housing or food insecurity or mental health or coming out or disclosure to peers. People who would get sick, would ill, may not be well enough to work, right? And so you had to consider the whole health needs of people. And as I thought about what Tawanda, was talking about, what Odalest was talking about, Odalest ran down this list of all the different sort of assets and deficits that might be present in his community. Community health workers don't have to be taught that. We know that because we are embedded in the community. We either grew up there, right? We share the history, we share the culture. We're not so removed that the only way we understand the assets and deficits is from, data collection, right? We don't have to conduct that research because there's a lot that we already bring from our life experience. So for me, number one, it was because I was sort of trained and brought in because of the compassion of my mom. And then number two, my community had really high concentrations. To this day, we have very high rates of HIV infection, particularly among youth. And so I spent a lot of time in that advocacy and doing that work in a very small geographic area. So I think those are some of the unique attributes to how we come to this profession. And that's why we talk about hiring authentic CHWs. Hire people who come with that trust, come with those relationships, come with that shared life experience. That's what we needed during the pandemic, right? That's why we've talked so much about misinformation and mistrust. We ask, who are the right messengers? Well, oftentimes CHWs are not well known to health providers or not well integrated into medical systems, public health systems. So we weren't always at the table when people were trying to develop messaging, when people were trying to figure out who was at high risk and how do we reach them. I bet Tawanda and Odalest knew when this pandemic hit their communities, who was going to be at highest risk for losing their job, for maybe getting evicted, when their children were out of school, who was experiencing high levels of stress, who needed food delivery or diapers or medication. This is some of the data that we come with when we talk about knowing our communities. And I love that the federal government is focusing now on rebuilding public health. Now is the time for CHWs to be a part of that rebuild, right? We don't want to be an afterthought. We want to be integrated as members of the care team.
Thank you so much for sharing all of that. I think even myself, thinking what you mentioned, it's always been on the back burner, and oftentimes community health workers are not appreciated as much. So I do appreciate you being able to talk about all those unique aspects, especially our lived experiences. Oftentimes we talk about making sure that someone has this certain degree or certification, but how can you get a degree or certification in lived experience? You can't, but that needs to be valued just as much as a degree or a certification needs to be as well. And that brings me to my last question. Across the country, community health workers have become trusted messengers on the front lines by accompanying patients, helping manage care, and building bridges between the community and the health system. These workers have remained instrumental throughout the COVID-19 response, and when this pandemic ends, we know that these workers will continue to support community members and remove barriers that we mentioned earlier to other health needs like hypertension, diabetes, nutrition access, child and maternal care. And as community health workers, what type of support do you need to continue doing this work and better serving your community? Can we have Tawanda please start?
Sure. But first, I wanted to say that Denise definitely hit all of the key points as far as being a community health worker. But I would like to say, because of COVID-19 and the racial and social injustice that happened, it really drew a lot of attention to members in Congress, and they're interested in the work that we do or community health workers do on a daily basis. So at Penn Center, we are working with our home state senator, Senator Casey, with drafting a bill that would introduce money into the Medicaid programs, and that will then be sent to community health worker programs that are proven to be effective. And I really like this bill because it really, they're really enforcing or having a requirement that will, again, choose community health workers. Well, the money will go to the community health worker programs that are proven to be effective. So we are, in the bill, it says that you have to definitely hire community health workers who are similar to myself, and also have project managers or managers who support the work of the community health workers. Also, caseloads need to be of a certain way so that community health workers are able to effectively do their work. And also money needs to go towards tools. So at Penn Center, we're given trans passes, iPhones, and those kind of things to make our jobs more easier so that we are able to focus more on the patients that we serve without any obstacles in our way. So that's really important. And Senator Gillibrand, we would definitely love to have your support and your Senate colleague support once the legislation is introduced.
Thank you for sharing that. That's actually really wonderful that you do have all those different supports. I know, I'm sure in different areas that, the different types of supports aren't there yet for community health workers. Odie, do you want to share what you think would help you or even help your team providing with being able to be provided more support for what you need to do to better serve your community?
So yes, works on the ground to promote education like about COVID-19 and vaccine. We build a stronger relationship with the community. So we need a week after COVID, or we can go more further. Let's say we can use us as a accompaniment for chronic disease. Let's say not focus only on treatment medicine, but the social part too. Let's take an example. Let's say we have a family who has asthma, and they carve the house, those triggers in the house. So the community health worker can go to this house, like show them, educate the family what those triggers are. So that means they can use us as we already have a stronger relationship in the community, and we can have the same opportunity, get some training as a community health worker. We need training, and we need something to coping with the grief. So we face those COVID-19 deaths because we are in the community every day. We know what's happened, and we in fact in the community, we know those people in grief, those things affect us too. So that means we need auto coping, auto training us the way like we can serve the community better because we have a passion what we are doing.
Mm-hmm. I know you have experience as being a doctor, correct? In in Haiti, and then you said you worked in Conj with Partners in Health. Do you feel like the experiences that you have had there, now that we have COVID-19 here, because I know that there's some similarities with some lack of resources and some barriers that people may have. Do you feel like that is something that's similar in Immokalee? I know you mentioned there's some great counseling because, as we know, you might be from the community or you can relate to the community. But do you feel like those experiences, like when you were in a more in a clinical role as a doctor versus like now as a community health worker, do you think there's different types of support that you may need now versus when you were just in, seeing patients in a different way?
So what I learned from Partners in Health in Haiti, so they are not focused only on treatment. They are focused on the social part. That's a good thing. So sometimes it's not only the treatment. We have to focus, we need like social part to help the community, to help the family. So help the family is the good thing, and I learned from it. Like sometimes not the disease. So you have to focus. Let's say we are witness what happened in the community now from the COVID-19. So when you say someone to quarantine or to isolation, so what if they don't have food at the house? So what we're gonna have to do? So that's what we do in the community. We look for the resource, and if we can have those resources, we bring them to the community. So we not only the treatment, but the social part is really important, like to help the family. I wish we can have all those opportunities and resources we can help the community.
Mm-hmm. And definitely those resources are really important that you talk about, whether it's someone needs housing, we know that, or someone, needs childcare or even food if they have to isolate and quarantine. And moving beyond COVID, that's still going to be most likely a necessity that people are going to need. And so I think that's really important that we talk about support. It's not only just support for, us as community health workers, but also for you all as community health workers, but also speaking about, money, funding is needed. People need food, people need, better ways to access even education. If you're in a town that has maybe a technical college or even a university, but they only offer morning classes, such as like in Immokalee, how do we help, our families improve and get more opportunities when they can't take time off from a 40-hour work week? And so those are like really important things, right? So there's so many different aspects. Denise, is there anything else you wanted to add about the support that you also provide now, but also as a executive director at your center, but also something that you see that you wish there was more of to provide that support?
Yeah, I want to continue the conversation that Odeleste was bringing forward. We know that up to 80% of what impacts a person's health and well-being happens outside of a doctor's office, outside of a medical treatment, outside of a prescription. Let's just think about that for a moment. Up to 80%, including our access to safe and affordable housing, clean water, healthy neighborhood, nutritious food, having health literacy, having healthcare coverage, being able to access care, being able to exercise, right? There are many other things that we call the social determinants of health, or that others call moving upstream. But we do not invest like that as a society. We know that the United States spends more than any other country on earth on healthcare, and most of that is downstream when people are already ill. So let's just drive home the conversation about equity for a moment. Whether you're a legislator, you're a payer, you run a health system, you're a community advocate, you're a business leader, you're a faith leader. All of us know that the same communities that we watch experience barriers to accessing high quality, culturally competent, affordable care in our current systems before the pandemic, they're going to continue in this burdened state, okay, disproportionate infection, disproportionate hospitalization, and unfortunately death as well, unless we change course. We really don't need more data For over 100 years, the US has been documenting the impact that racism and health disparities and health inequities have on communities of color at a disproportionate rate. So now is really the time that we need to begin to build on these lessons and make a commitment to equity, not just during the pandemic, which some of us are really doing now in forward thinking motion, but how are we going to sustain some of the innovation, some of the investment, some of the collaboration, some of the data collection, some of the partnership? So Tawanda shared something, and I want to say that the National Association of Community Health Workers is a partner with the Penn Center for CHWs on this issue. We endorse the document that Senator Casey is lifting up. We feel that it is critical to expand CHW allowable services in Medicaid. We want to transition away from fee-for-service. We want to ensure that these community members, CHWs, are not paid through short-term grants. And we want to fund the full range of our screening and our prevention, our social support, our rehabilitative support, all of the things that Tawanda spoke about. There are a couple of other things that I think are really important so that we invest these tax dollars back into community. Number one, we want to develop an equitable CHW workforce agenda. What that means is that we're hiring authentic CHWs from your community, right? So wherever your community is, rural, urban, whatever geographic community, and we want to partner with our CHW and community-based organizations. We need to prioritize direct investment. You know, a lot of times funding goes through federal agencies to states, or sometimes through federal agencies to very large nonprofits. But we know that it's small community-based organizations, faith-based organizations, food pantries and soup kitchens and cultural organizations that were decimated. And these are the organizations that are delivering food, driving people to their appointments, conducting home visits, et cetera. So we need to directly invest in these organizations. And then finally, we want to implement those interventions that are locally sourced. What does that mean? The community that is closest to the problem is often closest to the solution. Sometimes we don't know that it could be one key lever that a community needs. Maybe it's access to technology or the internet. Maybe it's health literacy. Maybe it's just knowing when to vote, right? Or understanding where they can, share their voice, share their stories that can make the difference between good policy and bad policy being implemented. So we want to really bring in the local voice and the local innovations and interventions. And again, we've seen this during the pandemic. Look at how communities have stood up a myriad of different sort of local groups and response teams and task forces. We can sustain that work to address the next pandemic, to address the flu or other issues like an opioid epidemic or an HIV epidemic. Other issues that people care deeply about. So this is a great time for the United States. And I hope that folks like Tawanda and Odelast and the tens of thousands of promotores, community health representatives, and CHWs that are working on the ground right now are asked to come in and share their leadership and their expertise during this moment, because there are great partners waiting.
Yes, most definitely. And Tawanda, is there anything I know you talked a little bit about different things that you felt you were able to help back in your community. Are there any stories or anything that really impacts you and continues and helps you continue doing this work? I know we talked about it can be very hard, especially living within these communities. You said you grew up pretty close, like I think 10 to 20 minutes from where you're currently working. Is there anything that you just wanted to share about why you continue to do this work?
Absolutely. So because of COVID-19, Penn Center wanted to ensure community health workers' safety. So we became social first response team. And so we started to work with patients over the telephone. So I went from being in person to meeting these people in person, knowing what they look like, meeting them at their home, until strictly working through the telephone. And I feel like we're still able to provide that service. I met Miss K one day through the phone with an intent to enroll her in the Impact program. And immediately she just jumped in and was like, I have this massive headache that just won't go away. So just me being a natural community health worker, I said, Miss K, who did it? And she says, everything is just crumbling apart. And she told me how she wanted to get a driver's license. She needed to see a therapist. Her husband was in the hospital. She didn't have a lot of money. She was actually spending her money on living in an Airbnb, which is really costly because she had issues with her family or her living arrangement. So immediately what I did in that 1 hour of time that she and I was on the phone was call the different resources that were available and link them to her. So I actually learned that she didn't even have a primary care provider. And so I wanted to help her to get that so that she can get the proper paperwork filled out, because one of her biggest goals was she wanted to do things right. She wanted to have a license. And I knew that was important to her. So once I was able to get those barriers taken away, or taken care of, I was able to do what I had mentioned before, the meet the patient interview. And I was able to dig deeper into who is this person. And I had learned that she was the black sheep of the family. And she just wanted strongly for her family to just love her, to just show her that she exists. And she was taking care of her husband of 30 years who was also sick. So I was just that person to be able to step in. And this is all through the telephone, step in for her and be able to offer her just some support, some empathy. I had learned that she was also in recovery and she had fears of relapse. And so I have knowledge of the Narcotics Anonymous. So I found out that she also liked to read. So I said, well, do you mind if I read you the Just for Today text for today? And when we read it, it was like so intimate. It was so passionate. And I related it to the things that she told me that she was going through at that time. And she stopped and she was like, who are you? Like, who are you? Like, I don't even know, like, how is this happening? And I just feel so comfortable with you. And I had learned so many things about her. And it was just a joyous moment to be able to, one, help her with those barriers so that she can accomplish the goals that she wanted to accomplish. And then two, just being there for her. And then I ended it with surprising her with a care bag. I'm really famous around the office for making these special care bags. And I secretly sent it to her. And she was just trying to figure out who it was. And then obviously at the end, I told her, okay, it was me. I sent it. And it was just like everything. So, yeah, definitely the work is still effective, is even more effective through the pandemic. But what stands out to me the most is that I can't even tell you what she looked like. She can't tell you what I look like, but there was a service that was provided and it was a very powerful one. And I love what I do.
And I think even from your story, and there's so many different components that we can pull out of there, right? How you helped her navigate the system so she could get to her goal. You went out of your way, I think, as a natural caregiver, and you say it yourself, and you should be proud of what you do. And I think oftentimes, like even in our society, you know, we're not community health workers are maybe not seen as a part of the team, or they might just be in addition to a clinic versus being, you know, someone who's very important to provide this care. But just hearing your story and thinking about what you may have done, and although this person doesn't even know who you are, like you're here fighting for them, advocating for them, and really just bringing them to a better quality of life, if you think about it at the end of the day. And that's what community health workers do. Odiles, did you want to share anything that you felt was something that keeps you going when times are really tough?
Yes. I hope like US can learn about COVID-19. I'm gonna share with you those. I have the opportunity like to educate about vaccine, and I remember one time Dr. Fene, I don't know if all of you know Dr. Fene Leon. We have opportunity to go to a church, and the pastor preaching about vaccine. So about the mistrust about vaccine, and one day I asked the pastor to have a meeting with him. So after I meet the pastor, and go back and forth with questions about vaccine or about the mistrust. And I'm able like to educate him, and he get the vaccine in all the church now. Between 80-90% of the church have vaccine. So we are capable to do a lot of things, educate the community. So let's say those community like farm worker, they don't have the opportunity to go to a doctor to ask about vaccine or to ask about those mistrust, about a lot of concern out there. So we are in the community, so we're capable to meet with them, to go back and forth, and we don't have, if we have to pass 1 hour with them to educate them about the information, the real fact, we are doing it. We are capable to do a lot of things. So I have a lot of experience, like work as a community health worker, like try to build the trust in the community. That's really have to go further more. And I hope like you as like every those leader can learn from it, and we can go more further up. Not only when we have a pandemic, they need us. So they need us forever, I think. And we are passionate for what we are doing.
Yes, and I don't think from what these conversations are talking about, even Denise, like, you know, the passion that you have, that where you talked about all these action items that we needed to do, and Tawana just sharing the story with Miss Kay, I believe was her name, and Odilesi, you going at your church and taking initiative and saying, hey, like, I want you all to be safe, and I want to share this information with you so you can have like, you know, hopefully if you do get COVID, things are a bit better for you. As we know, like it does help, and it's safe now. And so I think a community health worker never stops working, right? All you guys mentioned different times of your life that you know, whether it's a friend, and it doesn't have to be about COVID-19. It could be about anything, but you are going to help someone. If you see them, you know, in need, you are going to go and help. And I think that's the beautiful thing about community health workers, is that's not something you can teach so easily. You know, having this heart for people and for caring and for providing the support, it takes a lot on you, emotionally, spiritually, like, you know, a physical toll, but you're doing it, and you're leaning on these different experiences and, you know, your own lived experiences, as well as like these that you have had in your different roles, to bring you back into that. And I think that's what's really great about what the work you're doing and why the support is so needed. And I know we could talk about this forever, because it's so, I think, just exciting that that community health workers are being recognized more. And even on this platform, we can tell so many people about the work that you all are doing. And I know we only have a few more minutes, but does anyone have any final thoughts or anything they just wanted to share before we go on to our action items?
So I don't know if you can hear the noise in the background. I hope it's okay. Are you okay? Oh, perfect. Because my husband just decided to like do the lawn or something. I don't know. Some machine just turned on. That's how you know we're live. Listen, I just want to, everything that Tawanda said, that Odeles said, is one of the reasons why we are so awesome as a profession, and why it's such an honor to serve in the role that I am in as a young leader, to advocate and amplify this work, okay? The things that Tawanda spoke about doing, the things that Odeles spoke about doing, health systems oftentimes don't have a code for it, okay? They don't know, well, how do we chart this? How do we put this into the electronic health record? Is this the 30-minute session? Is this an hour session? Is this a diagnostic? Is this a screening? Because our focus is on helping. Our focus is on building capacity. In other words, we don't want people to be dependent on us. We want to see people grow and achieve the goals that they set forward. And we know everyone can't do that without support. None of us can do that without support. Just imagine if no one had clean water. But sometimes we forget that there are people living in the US without clean water, right? What if you did not feel safe stepping outside of your home to go take a walk? What if you just didn't feel safe? I mean, these are real issues. What if the bodega down the street upcharged your gallon of milk to $10? And you don't have a car to drive to Stop and Shop or Walmart to buy a $3 gallon of milk? Like, these are the things that make the difference for people's day-to-day lives. And those days become weeks and months and years. They become chronic disease, right? They become downstream problems that cost a lot of money. So I really just want to celebrate the innovation. And I also want to say that, like, as diverse as all of our sort of services are, Odeless spoke to that pastor and that church in a unique way. When he goes to the next individual or the next organization, it's totally different. It's based on the needs of the person. When Tawanda picks up the call again, another phone call, she is open and listening, right? Her orientation is on the person. So I feel, and I know that Penn Center has done some of this, and Odeless, because he's a doctor also, he probably wears these two hats. CHWs are incredible trainers for primary care providers. I know that that may sound odd to some people, but there are medical schools right now that bring community health workers in and ask them to train their first and second year students to work with their residents. Listen, we all have the same goal: reduce the cost of care, increase the access to quality care, right? Let's do this together. And I just feel like what you've heard today helps you understand, like, we know how to tailor services to the unique needs of people. Last thing I want to say, and I come from a long-winded family, so I am guilty of, but the last thing I want to say is how amazing community health workers are at working across sector. The services that Tawanda mentioned, you can't even tell what sector she's working in. She talked about addressing, people who might be in relapse or recovery. She talked about people wanting to achieve their own sort of workforce goals. She talked about a person wanting to get a driver's license. She talked about a family dynamics and people having goals to repair that. We work across sector. When I worked in HIV, as I mentioned, I had to connect with other CHWs who were funded to do a ton of different things because that one person needed a lot of care. So we want to be a part of this conversation. Upstream work, cross-sector work, clinical community integration, whatever you call it, a lot of times we do it already because that's what people need. And so, like I said, this is a great call. And I don't know who's listening, but I hope lots of folks are excited about connecting with CHWs and CHW-led organizations in your state, in your county, in your community.
Those are great action items, Denise. Tawanda or Odie, would you like to share any final thoughts?
No.
Tawanda, anything you'd like to share?
Can you hear me?
Yes, we can.
Okay. Well, I want to just also add that one more thing that we do at Penn Center is a mentor program. And this program is really important to me because we take up and coming nurse practitioners and resident doctors, and we allow them to shadow the work of a community health worker. Some of them are not even from our area, so they don't know what our community look like. So we get to take them into the community and show them the different bodegas and Chinese restaurants and so forth. Also, we get to do a home visit with them. We ask them to wear comfortable shoes because there's sometimes places in Philadelphia that takes a very long time to get from one point to another point. So the patient is going to be late if they're non-ambulatory or have issues around ambulatory. Also, they may live in a high rise on the 19th floor and have issues with walking too, but they have to wait a few times for the elevator to come up and down for them to be able to get on. So they're going to be late. So it teaches them how to be more empathetic to the sensitive population in which they are servicing. And this is an awesome program. And all of the nurse practitioners and up and coming resident doctors, they love the program. They always report back wonderful things. And I always ask them, what would you do differently? And they always say that there will be like more understanding. So I think we need more of that kind of stuff too, more resident doctors or doctors in general or nurse practitioners or the people who service our community to be able to go out and shadow community health workers' work so that they're able to be better understanding when it comes to serving our population. I want to end with that.
Thank you. And I think that is so important. I actually have never thought about that, to be quite honest with you, but why not speak to the folks who are in the community who have the most access? Because I know doctors only have about 5 minutes. And then after that, what do? You can't really help in that regard. But I think that's an amazing thing to continue to do, as well as hopefully other community health centers will start to do that as well. So thank you, both of you, for sharing that. And I just wanted to thank you all, Denise, Juan, and Odiles, for joining me today and talking about why community health workers and what you do is so important and critical to improving care, access to care in the U.S. So I just want to thank you so much for being open and willing to share. I know it can be hard working within your community, and I just really appreciate your heart during this time. And now, audience, you may be thinking, what can I do to support this workforce? We just heard from these 3 amazing people about the work they're doing. And I know it's easy to feel like we don't have the power to make changes. So some key action items that you can take away from the past hour, whether you're watching this from your desk, your couch, your bed, or wherever you're tuning in from, is first, go to the website at the bottom of the screen, pih.org/health-workforce, and reach out to your senators today. Here, you'll be able to send an email, make a call, and even tweet at your elected officials about the importance of support for community health workers in the Build Better Act. And as we wrap up this afternoon, I want to thank you all for joining us this past hour to learn from Senator Gillibrand, Tawanda, Odiles, and Denise. Everyone brought something vital to the conversation. Senator Gillibrand talked about the importance of policymakers investing in community health workers. Denise provided so much historical context and framing of this discussion. Tawanda shared her heartfelt stories and experiences. And Odie shared the importance of listening to the people we are serving, knowing they are the experts in their own lives. Together with investments from community members, advocates, organizers, and political leaders, we can build the community health workforce of the future. To those of you listening at home, thank you again for taking the time out of your day to join us in learning and taking action. Have a great afternoon and rest of your day.
Thank you.